It's a time when there's a lot of hope. You know, if you ask these women, they want the baby's life to be different. But in the end, we don't give them any hope.
After hours in labour, a new mother hears her baby cry. Police officers stand guard as child protection workers enter the delivery room. They tell the mum they're going to take her baby.
In some ways, they're also deemed as not worthy. You know, so we don't treat them like human beings.
Jane, not her real name, has first-hand knowledge of how South Australia's Child Protection Department removes newborns from public hospitals. She doesn't want to be identified, but says practices need to change.
You can hear some horrendous stories where women haven't actually completed the birthing process, as in, you know, they haven't delivered after birth or something like that, and the department's already in there removing the baby, or they're needing to get sutured because they've had an episiotomy, yet the department's sort of in there.
Last financial year, more than 100 babies aged under 1 month were removed from their mothers. Of those, about a third were Aboriginal, and most were removed before they were 1 week old. Similar rates were recorded in previous years. Among the reasons babies might be removed are suspicions mothers are unfit to parent, live in inappropriate housing, don't show up to antenatal appointments, or misuse drugs and alcohol. Jane says often they're not told before giving birth that their baby will be removed.
Up to 80% of mothers don't know before they've had the baby, so you could imagine going into hospital, you know, you've been pregnant for 9 months, and then all of a sudden in comes the Department for Child Protection with a piece of paper that says that we're going to take your baby away.
SA Health policy states that infants are not to be separated from their mother other than for medical reasons until Section 41 legislative powers authorising their removal have been invoked. But Jane says it's not uncommon for the Child Protection Department to ask hospital staff to take a baby out of a ward so that it's already separated from its mother when the removal papers are issued.
There's a range of things that happen, you know, which legally shouldn't happen until the notice has been served.
The ABC requested interviews with SA's Department and Minister for Child Protection, but both declined. In a statement, Minister Katrine Hildyard said she expected the department to treat families with respect. The department's Chief Executive, Jackie Bray, said the agency works with families and service providers to ensure it can achieve best possible outcomes for infants identified as being at risk of harm. A review of current policy is due to be complete by the end of the year, but Jane says the government isn't being open or honest with vulnerable families.
And overall, how would you describe the way that mothers are treated?
Inhumanely.
Stephanie Richards, ABC News.